for your reliable Tennessee Valley forecast.
So glad you're staying with us this morning. In case you are just tuning in, we have come over to the Hamilton County Health Department. Dr. Fernando Urrego, who is the interim health officer here at the health department, has agreed very graciously to give us a good bit of his time to talk about COVID-19 and the vaccine. We were talking earlier about the Delta variant. There is a real concern. A lot of parents are confused. They're a little bit scared about whether they're doing the right thing because the Delta variant seems to be more of a problem this go around for our kids. Why?
So the surge that we have now with the Delta virus is definitely very different than the surge that we had about a year ago. The Delta variant is significantly more infectious. So if somebody has the infection with the Delta variant, they carry a significantly higher viral load in their nose, which is why it makes it so infectious, which is why you may recall a couple of months ago, vaccinated people didn't have to wear a mask inside or outside, and now that guidance has changed. And the reason the guidance has changed is now we know that even vaccinated people can transmit the Delta. So it is a different surge altogether. And what we're also seeing is that this time around, kids are being affected more than before. So I think the discussion of the current surge, school, masks is an important one.
I have heard people say, questioning it, could it be that as the vaccination rates have gone up, and we've seen adults primarily getting vaccinated, is the virus looking for somewhere to now live? And is that therefore causing it to mutate and go to a younger population? Have you heard that theory?
So I think it's partly true that one of the reasons that we're seeing more kids infected is now that our older people in the community are vaccinated, particularly our senior citizens who really their vaccination rate is great. So like you say, the virus is now looking at where it could go, and it's looking sort of for the path of least resistance, right? And that's going to be people that are unvaccinated. And since our kids, there's a big proportion of kids less than 12 that are not vaccinated, that's where it's going to really want to go.
There's a difference in the virus going that direction and the virus mutating, however, right? The Delta variant.
Yep.
There could be future variants, probably will be, behind this one. So is it reasonable to think that if now we get the younger population vaccinated, will there be another strain that still tries to find its way in to another weakened population?
So viruses mutate all the time. The SARS-CoV-2 started to mutate on day one, and it will continue to mutate for as long as it's around, right? So the only way to stop it from mutating is to protect as many people as possible and to break the chain of transmission. So this is really a matter of if we can protect as many people as possible, the virus is not going to have the opportunity to reproduce or to its gene sequence and for us to have to worry about another variant.
Okay, I go again. I'm going to be ignorant with you. So you say the way to stop it is to stop the transmission. Yet, people who are vaccinated, right now the popular one is Mayor Kelly here in Chattanooga, who was very forthcoming to say, I got the vaccine, but now I've been infected. So if you can get the vaccine, and yet you still can not only carry it, but can become symptomatic, how do we stop it?
I think it's a matter of the more people are protected, even though once you've been vaccinated, there is the risk of transmission. The risk is less than you haven't, in that if you haven't had your vaccine. And if more people are vaccinated, so if you add the risk of every individual now vaccinated over time, there's going to be few people out there that are going to be able to get infected, and less people out there are going to be able to transmit it to others. So that's really the concept of herd immunity, and that's what we're trying to get. At some point, the virus is not going to be able to move across people as easy as it is right now. But it's going to take the community, it's going to take everybody to really get vaccinated and protect themselves. The risk is always going to be there that you can get vaccinated and you can transmit to others. These vaccines are not perfect. And what we know now with the Delta sort of in the game is that before we would say the vaccine is perfect, it's going to prevent transmission, it's going to prevent you from going into the hospital, and it's going to prevent you from ending up in the ICU and potentially dying.
Okay.
What we know now is that that transmission part is not as good as it was before. But the vaccines are still great in keeping you out of the hospital, keeping you out of the ICU, and keeping you from dying.
Can we address what I'm sure you've heard a lot, the vaccine and fertility?
Yes. So obviously there is a concern. What we know looking at the data is that there is no way that the vaccines in any way can interfere with fertility. There's just conceptually and mechanistically how the vaccine works, there's no way that it can affect fertility. In fact, if we think about it, many of the participants in the initial studies got pregnant while getting the vaccine. And now that the vaccine has rolled out, there are many people getting pregnant after getting vaccinated. So I think that is one of the many myths out there that I think is important to really say with confidence, without any doubt, the vaccines do not affect fertility.
I spoke to a doctor in town, a pediatrician, which, by the way, before stepping in as the interim health officer, that is your training, coincidentally, right here in Chattanooga,
yes.
pediatric pulmonologist.
Yes.
So you are the man to be equipped to be sitting in that chair.
I hope so.
This morning. But I did speak with a pediatrician, and he was saying that parents are asking this question of him as well. And he told me something I had not ever heard, that in the history of medicine, there has never been a vaccine presented that did not reveal the side effects it was going to have after the 6-week mark. Is that correct?
Right, that is very correct. So people who work with vaccines all the time, when there's a new vaccine, they know that there is a window, whether it's 6 weeks, whether it's 3 months, or whether it's having given the vaccine to 100,000 people. Mm-hmm. At some point, you know that if something bad is going to happen, if there's a bad outcome from having had the vaccine, it's going to show up in that window, right? And here's where we are right now with the COVID vaccine. We are almost a year in, and we know that really there aren't any concerning side effects. And we've vaccinated globally billions of people, billions with a B. And there is no concerning signal that these vaccines have any concerning adverse effects.
Okay, I got to take a break. I do want to talk about the vaccines a bit more when we come back, and we do want to get into your kids and masks. There's a lot to still cover, so we're back with more in just a minute. Aren't you glad you're watching this morning?